Well, I'm going to go ahead and get things started. Good afternoon or good morning. My name's Jessie Mandel, and I'm the National Program Director at Healthy Schools Campaign. Thank you so much for joining us today for our webinar on how to protect student health and school Medicaid in your state, where we'll dive into your questions and have a discussion with some incredible advocates and leaders about how they are continuing to protect and advance Medicaid and student health at this critical time. For those of you who are not familiar with Healthy Schools Campaign, we work at the intersection of education, health, and equity, ensuring that all students have access to comprehensive, sustainable school health services is core to our work and to building positive school environments. We are committed to protecting Medicaid funding and the vital role it plays in supporting children's health and well-being. This webinar is being recorded, and we will send out the recording, slides, and resources after the webinar. In addition, both the chat and the Q&A features are enabled. So if you would like to ask a question, introduce yourself, or make a comment, we welcome you to do so at any time. And shout out to my colleague, Allison Paxson. You'll see her in the chat and adding information throughout the webinar. For our agenda today, I'll provide a high-level overview of Medicaid's role in schools and how Medicaid cuts will impact school health services. And from there, my colleague, Lena O'Rourke, will talk about the federal context around Medicaid and school-based health services. And then we'll dive into a panel discussion with experts in the field and your questions. We were so thrilled to receive so many questions in advance. Thank you all so much. We'll be answering them throughout the webinar and during our Q&A. Additionally, we will also send out the questions and our responses after this webinar too. So briefly, I'd like to start with why school health services are so important. The research is clear. School health services improve student health and academic outcomes, including for students with chronic conditions, students with disabilities, and students with mental health and behavioral health needs. What's more, schools are essential to reducing health disparities and access barriers. For example, children living in low-income households with special health care needs, of those children, approximately 85% do not receive the necessary care they need, primarily due to financial barriers and limited access. Meeting children where they are every day, providing access to health services in schools can reduce these barriers and help students learn and thrive. And these challenges are even greater now. So as we'll be discussing today and with our panelists, many students are experiencing greater trauma and threats to their safety and their family's safety in and around schools now. This is creating more mental health needs for students, especially for those students already facing some of the greatest inequities and disparities to care. Meanwhile, healthcare is also getting more expensive. Many families are experiencing higher healthcare costs and barriers to insurance. And all of this affects the role that Medicaid plays in schools. So what is Medicaid in schools? At a high level, Medicaid pays for health services included in the individualized health plans or programs, the IEPs, for students with disabilities and for general education students enrolled in Medicaid. Medicaid is the fourth largest funding stream for schools, supporting well over $8 billion every year for health services. And in recent years, bipartisan support and investments for the program have increased through updated federal guidance, the establishment of a federal technical assistance center, and state grants. And by July 2026, all states will need to update their policy to align with new federal guidance, and many states are working to do this now. Here you can see how states are taking action, how many more states are using Medicaid funding for school health services. Over half of states have taken action to reimburse for services outside the IEP. And while we're not getting into the specifics of the school Medicaid program and billing in this webinar, we do encourage you to check out some of our other resources. We'll put those in the chat and share that afterwards so that you can learn more about the specifics of this program. So the question now, though, is how will federal Medicaid cuts impact school Medicaid and school health services? As many of you know, H.R. 1, also known as OBA or the One Big Beautiful Bill Act, cuts over $1 trillion in federal funding from Medicaid over the next decade. Now, H.R. 1 does not include specific changes to the Medicaid in Schools program, but these federal cuts will have a significant burden on state budgets. In order to close budget gaps, states may draw from the general fund or education budgets. They may reduce Medicaid benefits or raise taxes or some combinations of these actions. And these actions will have implications across school districts and school health services, affecting funding overall, as well as the care and services that schools can provide. Medicaid reductions will put a strain on the school health workforce and administration of Medicaid in schools. And because of the changes in H.R. 1, Medicaid eligible kids may experience greater obstacles or confusion to how to maintain their coverage. And fewer kids enrolled in Medicaid means worse health outcomes for students and less money for schools. And so, in this moment, for states and for school districts, it's all the more important that states and school districts double down on the importance of the Medicaid in Schools program. As states face these reductions and changes, it will become even more essential that schools can maximize and leverage all the federal funds they are entitled to, and to help mitigate the impact of other reductions. Strengthening school Medicaid now can be a key way to protect school health investments going forward, to help mitigate that impact. So with that, now let me turn to my colleague and school Medicaid expert, Lena O'Rourke, who will take that step back and provide an overview of the federal landscape and the levers affecting school-based health services. Thank you, Lena.
Jesse, thank you. And thank you all for being here. My name is Lena O'Rourke, and I work with the Healthy Schools campaign. And Jesse just went through what's happening in school Medicaid. And my job is to tell you what's happening across the country and here in DC that could impact school-based services and Medicaid more generally. So let's talk about the federal levers and what's happening. What can we anticipate for Medicaid in Congress? Well, Congress has probably taken all of their big actions on Medicaid with the bill that passed last summer, H.R. 1, or the One Big Beautiful Bill Act. There are other changes that are being considered, and there has been a lot of talk about another healthcare reconciliation package. But I think the reality is that Congress has a lot of other things on their plate and not a ton of time before they start to really focus on elections. So all this is to say, it's not likely that there will be additional major changes to Medicaid. That said, though, there are still possibilities to create change, both good and bad change, in Congress around Medicaid and student health and well-being broadly. So federal advocacy remains incredibly important in educating Congress and building Medicaid and school Medicaid awareness remains critically important. And we can talk a little bit about that as we go. What can we expect from the Trump administration? And the honest answer is we don't know. Their direction on Medicaid and education has been very public and very damaging, impacting, as Jesse has already outlined, students with disabilities, students in immigrant communities, Black and Brown students, families experiencing poverty. At the same time, the Trump administration has not made any changes or direct cuts to school-based Medicaid. So let's acknowledge the whiplash that this has caused. And I know all of you on this call are feeling it. The layoffs at the Department of Education and the reassignment of certain federal education activities to other agencies, and what that means in the short and long term for student health. SAMHSA's very arbitrary and very public cutting of billions of dollars in federal mental health and substance abuse grants, including to support student health, and their immediate reversal of those 24 hours later. The policies that are making it harder for schools to provide health services, reductions in mental health grants and survey data. And all of this is contributing to a level of instability that we can't really gauge for. And importantly, it makes it really difficult for state agencies to plan and execute their missions regarding school-based services and student health more generally. So then that's the big Trump administration. Let's dig down a little bit into more specifically what's happening at CMS, which is the agency that oversees Medicaid and the school Medicaid program. CMS is suffering from huge layoffs and brain drain as well, and they have a huge task in front of them in implementing HR 1. As we know, school health services have never been at the top of the CMS radar, and they have made no changes to this program that directly impact this program, I should say. The policies haven't changed. The 2023 school Medicaid guidance still stands. CMS continues to approve waivers. They recently approved Utah's waiver, which congratulations to Utah, and other states are continuing to build with CMS's support and release information about school-based services. Yes, it is at a glacial pace that we see this moving forward, but as the signs and marathons always say, forward is a pace, and that is still happening. CMS also just last week released a huge toolkit on coverage of mental health, behavioral health, and substance use services through EPSDT, which has a big focus on schools. So reaffirming CMS's commitment to services, including in schools. So in summary, we don't expect a big change in school-based services policy, and strongly encourage states to continue moving forward in school-based services and to keep reaching out to the TAC and CMS with your questions and volunteering us, Jesse, but we'd be happy to support in that. That said, there are still a lot of implications for all of this on schools and school health services as state legislative sessions come into place, as they grapple with what they need to do. And it is understandably difficult at this minute for states to make decisions on Medicaid. They have huge competing demands and inconsistent guidance from CMS on the broader Medicaid package. And they have to implement HR 1 and identify how to absorb $1 trillion in cuts without hiring more people or impacting without hurting people or impacting the broader healthcare system. And they still have to provide coverage and figure out how to get kids the services they need. So as they're going through this, and as you're listening to this, you'll be hearing lots about states implementing school health services, HR 1 services in Medicaid. You might hear them, the buzzwords to listen to, so you know it's a Medicaid conversation, might be work requirements or provider taxes or immigrant Medicaid. These are the things that states are talking about right now. And that doesn't sound like school-based services, but each of these changes will have impact on kids and their families and how it is covered and how states finance their Medicaid programs. And as Jesse's slide indicated, how it doubles down to to schools. So states are struggling with this and will be figuring out what to do. And they will all these changes have the potential to impact school Medicaid. So yes, the federal picture remains a little bit static, but also a little bit confusing. It's a little bit grim to figure out how states will get this picture together. But I cannot stress enough that education, advocacy, and public input remain critically important at every level. And that is why I'm so excited, Jesse, to hand it back to you now and to let you pivot to the panel who can talk about what this really all looks like.
Thank you, Lena. Thanks so much. That was such a helpful overview of where we're going now and the discussion we have ahead of us. So thanks for providing that perspective, and you will be back later for more questions. But for now, I'm so excited to turn things now to our panel discussion. We have brought together a terrific panel to really think now, what do we do? How do we respond to defend Medicaid and school health services moving forward? And our amazing group of panelists are state Medicaid and school health advocates and leaders from both red and blue states. And the experts on this panel, why we're so excited, one of the reasons is that they're working to protect and strengthen Medicaid and student health, but all coming at this with a very unique perspective, taking different approaches and navigating different challenges to keep school Medicaid and student health moving forward. So I'll introduce them now, and then we'll be sharing their full bios after this webinar. But joining us today, we have Erica Lee, Health Policy Analyst with the Florida Health Policy Institute, and Stephanie Altman of Counsel at the Legal Counsel for Health Justice, Nikki Montgomery, Parent Advocate and Director of Strategy and Communications, and Carolyn Tregembo, Executive Director of the Colorado School Medicaid Consortium. I think we're all on the screen now. That was excellent timing. Thank you all so much for being here. So Nikki, let's start with you to kick off this conversation. Your work really centers parents and kids' voices so students can get the care they need. Can you tell us a little bit about yourself and also how Medicaid makes a difference in your child's education and then in the work that you're doing to get parents and families involved?
Certainly, I work with Family Voices, which is a national organization that's focused on children with special health care needs and disabilities. And when we talk about special health care needs, we are talking about a range from children who have maybe asthma to children who have rare genetic conditions. And so it covers a broad swath of children, actually 1 in 4 children in the United States. And so when we're thinking about the needs of those kids and how Medicaid can support them, Medicaid provides, of course, a lot of that support over the lifespan. What we've been experiencing is a lot of families with questions about the reductions that might happen in their states and home and community-based services being reduced. So that does make Medicaid services in school essential. And the other thing we've been hearing is families don't always understand the conversations that are happening. And so what's the terminology? What do they need to know to participate? And that's where we've really been leaning in and creating policy education tools so families can participate in that conversation and know what they are agreeing to, listening to, and know what's happening in the world around Medicaid so that it's not so confusing. So really taking a health literate approach to explaining Medicaid is something that we've seen as essential lately.
Thanks for that. And can you talk a little bit more? I know you've thought a lot about how to get parents involved in the process more and to also feel confident in engaging in the process. So I know you kind of touched on that, but are there other ways that you think about engaging, involving parents?
Well, obviously, there's opportunity to involve families in advisory councils and groups for Medicaid statewide. But any group that you've integrated families into can help to provide some insight on how they're experiencing services. And so in some states, families are concerned about the fact that if they use Medicaid services in school, they may lose community services. That may or may not be true. And so you want to make sure families have the facts about what's going to happen to their own services in their own states and can ask questions and have a point person where they can ask those questions. Also, like what families are experiencing in the school setting may be different from state to state. So it is important that while we take a national lens, we do have to get into the communities where families are and hear from them. Families also are encouraged to just ask those questions, know how their information is being exchanged among these systems, where it's being housed. Those can be some of the things they have concerns about when they're talking about giving health information to the school and vice versa. So I think the security of information, who has access, how it will be used, those things require some trust to integrate and have families involved in. And so you have to really lean into the conversations that build that trust with families. And that's what we're hearing, is that people don't know who to trust, what information to trust, and often what they hear is contradictory. So making sure they have opportunities to ask the questions that are of concern to them and their families.
That's so great. Yeah, it's building, those how to empower families and ask those questions to build the trust in the program itself so that we can, be protecting it. Yeah, That's so helpful. Thanks so much for that. Well, let me turn actually now to Stephanie. I could have more questions always, but Stephanie, let me turn to you and kind of build off of that. I know parent voices are really important to the work that you do too with the Protect Our Care Illinois Coalition. Well, tell us a little bit about your work and then just how the coalition engages parents and builds those ties.
Sure. Thanks, Jesse, and thanks, Nikki. So I work at the Legal Counsel for Health Justice. One of the projects within our organization is called the Chicago Medical Legal Partnership for Children. And we do a collaborative medical legal partnership with area hospitals. So we're providing legal care with their medical care within the hospital, working with social work teams and the doctors, et cetera, in order to build like kind of a more holistic approach to if families need benefits. It's kind of a one-stop shop. And in that, we do a lot of individual representation around special education, around needs that children have in schools, and especially for medically complex children. So it's like a coordinated effort. And that's kind of on the individual side. But those cases and those issues kind of rise up, in terms of systemic barriers that we're all facing and trying to deal with. And so we have a coalition called the Protect Our Care Illinois Coalition. We actually started it in the beginning of Trump 1.0 when, sorry that there's a 2.0, where the Congress was trying to repeal and replace the Affordable Care Act. And the coalition's really grown to over 100 organizations. And while we've worked on proactive work, we are now back to a responsive and reactive, trying to first, we tried to do whatever we could to stop HR 1 from passing and some of the most draconian provisions. Obviously, it passed, and now we're in the point where we're defending and trying to mitigate harm. So Protect Our Care Illinois, we lead it along with other groups and organizations in Illinois. In particular, I'll mention Ever Thrive Illinois, that really works a lot with school-based health centers and children, and our parent group organization, Kofi. And I'll put these links in the chat afterwards if you want to visit. And that is the Community Organizing and Family Issues. It's comprised completely of parents, and they bring issues to Protect Our Care. They also advocate for issues for both students and family care, as well as coverage under Medicaid. We were super excited because one of the parents from Kofi, who also participates in Protect Our Care, was invited to Washington, D.C. on the night of 2 nights ago, on the night of the State of the Union, and with Representative Delia Ramirez from Illinois, and provided counter programming, kind of showing what it was like from the perspective of a mom who has a child with asthma and how she depends on Medicaid, and her fears of how that coverage is going to change. And I'll put the link to the recording, but it was exciting that she was featured. And so that's like a really good example of how parents are very active in our coalition, and how they can, if they have time, obviously have that role in advocacy.
So great. And we'll share all those links out too, but thank you so much for sharing this. That's awesome. Okay, one other question before I turn to you, Erica, but you mentioned, now you're thinking about policies to mitigate the harms. So at a high level, what are sort of the broad state policies and changes that this audience should be thinking about and monitoring that can affect, access to care, students' access to care, families' access to care? What are some of those general policies and changes that you're working on in Illinois, of course, but that might be of interest to this audience, and be thinking about in Illinois and also in their own states, other states too?
Yeah, so we're working on a lot of policies and a lot of ways that we can participate as stakeholders, not just us, but Medicaid recipients and families in the implementation process. Acknowledging that we are in Illinois, it is largely a blue state, and I know these same opportunities may not be available in every state, red, purple, and blue. Our state agencies do want to do the right things and do want to mitigate harm. That doesn't always mean in implementation it's going to be perfectly done. But a couple of things that we've already worked with the state on and that I think would be helpful in any state you're in to kind of look at is how parents are categorized under Medicaid. Many parents were actually funded and categorized under parts of the Medicaid Act that are not subject to work requirements at all. So there is some looking that our state had us kind of do, and we did a little kind of geeky behind the scenes kind of help on that. But it's like a question you might ask your state because a lot of parents were covered under a certain parent coverage group. That being said, there's going to be a lot of parents in the group of adults that could have work requirements imposed on them. So first would be getting kind of everyone that is not in that group, properly not in that group. And then if they are in that group, we're really looking at, before we even get to education outreach on work requirements, trying to make the reporting processes as easy and seamless as possible. Most parents and families are also on SNAP. So we're looking at now the problems that are happening in Illinois with SNAP implementation and proving work, proving exemptions and caregiving exemptions, and seeing how that teaches us something about what we should do better when Medicaid starts in terms of that. Also, how can we make sure that our state processes, for example, automatically look at exemptions for parents with children in the household 13 years or younger, and how that also applies to other caregivers like grandparents and things like that. So I think just looking at those policies, asking the state what they're doing. Illinois is setting up, and I'll put the link, a stakeholder process in place. If your state doesn't, isn't real open to like, let's have all the advocates, be part of the stakeholder process. The states are required at least to have the Medicaid Advisory Committee and now the Beneficiary Advisory Committee, the MAC in the back. And so we use those two as a public forum to bring up these issues.
Stephanie, thank you so much for that. That's really great. And just because most on this call, I think, are well aware, but the parents' coverage is so closely tied to kids' coverage too. So even if these restrictions aren't going to be directly focused on kids, of course, when parents lose coverage, that directly affects kids' coverage too. So that's all the more reason why we have to think about, parents in relation to how kids' coverage works too. Thank you so much for that. So moving to a state with maybe a less of a different political environment, Erica. Thank you so much for being here. And so we know you're doing a lot to mitigate harmful Medicaid legislation in Florida. But I think to start with, you're also doing a lot to strengthen school Medicaid policy too. So can you start by just sharing a little bit about sort of the school Medicaid policy that you're working on, and knowing that it's in kind of happening while other more harmful legislation is taking place, but you're also advocating to kind of move school Medicaid forward. Can you talk about that?
Hi, thanks, Jesse. And hello, everybody. My name is Erica Lee. I'm a health policy analyst at Florida Policy Institute. We are a nonprofit, nonpartisan organization, research think tank that really advocates for policy we believe is going to improve the health and well-being and quality of life for all Floridians, no matter where they come from. And so that being said, we do have a large health policy arm. And thank you to Karen. That's really sweet. Now I feel, no pressure. But I'll say that we have been on the school-based Medicaid train for a very long time here at Florida Policy Institute. So a lot of this work predates me. I will say that back in 2018, our senior policy analyst who had a special interest in school-based Medicaid really took it upon herself to learn about what provisions of the law were available and how we could maximize those Medicaid funds. And so there was a report that was written in 2018 about all of the potential benefits and additional funds we could get if we would opt into this and if we would change our statutes to allow for more school-based Medicaid funding. Once that report was out, it became clear that we needed to let the legislators know that this was an opportunity that they could actually take advantage of. One thing is oftentimes things pass at the federal level, or CMS will provide guidance, and then we're not sure at the state level what to do with that. And so with that, we saw that there was a need for legislative action. And in 2019, we had about 16 organizations recruited to support initiatives and federal um, initiatives towards increasing the school-based funding. And so that coalition was made up of a wide range of partners, including United Ways of Florida, Florida PTA, Florida Voices for Health. There were school-based advocates in this coalition as well. And so they were able to secure bipartisan sponsors for a bill that would end up passing in 2020, which was HB 81. And it was to basically to get Florida's legislators to comply with the CMS funding streams and everything like that that would allow us to draw down those federal funds. So this passed, and that was really great. The thing is, the issue since then has been that actual implementation not moving forward in the way that it should be. And so ever since this process, we've been waiting for, state plan amendments and things like that that would actually include the full benefits, all EPSCT benefits. And the way Florida Policy Institute has continued to follow up on this has just been to ask questions of our advocates when they're available. So to this day, as I have inherited some great partners within the school districts who will tell me, hey, like, this is where we're at. Have you heard anything from ACA? ACA is our agency for healthcare administration in Florida. So they are actually responsible for implementing all of these things. They come with their rulemaking processes, and oftentimes things get delayed in implementation with any sort of medical programs in Florida when it comes to ACA's implementation. So we see this not only with things like school-based Medicaid, but also children's health insurance, et cetera. It all kind of gets lost in the sauce sometimes. And so when it was brought to our attention recently that this was still not implemented, we've been reaching out and saying, okay, what is the agency actually doing? We reached back out to the bill sponsors. Who passed this law, and they were still not aware that this wasn't being implemented. And because it was back in 2020, it was almost like they had completely forgotten they even passed this. And so oftentimes it comes to us going back to the board, relying on our partners, and then leveraging those resources to then say, okay, like, is ACA meeting with the school districts at this point, which we hear they are. And then what can we do on our end as this policy institute to take it back to legislators or other people who might be able to poke and prod and push on these things if they are initiatives that actually matter to the original bill sponsors, and we ask, why haven't you followed up on this? Why are you unaware of this issue? And so that being said, I would say like the strength comes in partners being able to have the historical knowledge of what's been going on. I will say I'm not always the expert on these policies or how they're implemented or why they're not moving, but it always helps to have those folks on the ground who are willing to, slide me a meeting link and say, hey, like, you can have this, go listen for yourself, but I didn't give this to you, right? Like this is how we move in Florida because oftentimes like we need those partners. We need reliable ears in the room who can then take this to other people. And so our network is vast and incredible in that sense, and we're always willing and looking for other partners who can help us understand the nuances, and then understanding that it also looks different in every district in Florida, right? And so for those of y'all in from Florida, I saw you in the chat. You don't know me, then please send me an email because I love to learn from you and learn from each other as well. So yeah.
That's so great. I mean, thank you for that. And it's amazing the work that you're continuing to move forward in a tough environment. I guess Carol, before I turn to you, I'm just thinking, do you see, it seems like you're not necessarily seeing pushback to this right now, even as there's other sort of pushback against, there's a lot of pushback in Medicaid more generally. how are you, how do you kind of navigate that, or do you navigate that? Do you find that there's generally still support and enthusiasm for school Medicaid?
So that's a good question. We're monitoring the implementation. We had a deadline of July 1st this year for this, and it's still seeming like that's going to be delayed. And so we're continuing to monitor this and seeing if there's anything that we can do to help push the needle ahead. But yes, you're absolutely correct in that we are at a time where we're also fighting a lot of medical cuts across the board from HR1, but then also because Florida was not a Medicaid expansion state, a lot of the policies that are in HR1 did not apply to Florida. Yet our legislator this year is trying to implement things that we shouldn't be implementing. So, for example, we have a bill that we've been fighting this session. It's SB 1758, which is work reporting requirements for our Medicaid program for a non-expansion state. So I've been screaming for weeks about why this makes no sense and is actually illegal. But it's we're defending against that. It was mentioned earlier, we're talking about immigrant protection for medical rights. There's legislation, HB 693, this legislative session that actually had language in it to remove the IKEA option, which keeps children who are immigrants eligible for their Medicaid. And by going back to the drawing board on HB 693, we were actually able to get that language amended out of the bill. So that was really good news because it came back to the fact that the legislator's intent was not to take Medicaid away from this population of immigrant children. They just didn't understand how the law was actually working. And so when we go back and we convene with others, and work together across our state, this is how we can stop and reverse a lot of these bad policies. But right now, a lot of those cuts are going to affect our Medicaid program. And I will just broadly say, before I pass it off to you, is that I'm already looking at our state budget for this year, and what I can see is that our trust funds are not keeping up with our general revenue output. And so that means that we're already starting to see the impacts of those federal cuts and trying to see what legislators, what the House and what the Senate is trying to do to alleviate that pain. But we're already seeing that even though we're increasing our general revenue, our trust fund revenue, our federal funds are decreasing or staying the same. And so lots of red flags. And what we're doing to raise awareness of that is, again, these analysis, writing about it, talking to reporters, talking to organizations who have storytellers, and doing anything that we can to just make noise and raise awareness, and then not forget the historical facts that tie back to this is all because of last year's implementation of HR1. We're starting to see this now, and here's exactly where, and here's exactly why and how. So that's been really huge for us to do, and it's been super great, super tiring, but great work.
Yeah, thank you. I mean, thank you for all the work you're doing right now, because it is tiring work. Screaming takes a lot of energy when you have to be loud and stay loud, but it's also incredibly important in this moment. So thank you so much for doing the defensive while also, offensively moving school Medicaid forward too. Well, okay, more questions about Florida, always. But let me first turn to Carolyn, and then and we get to the Q&A after that. But Carolyn, you are in Colorado, so zooming up across the map, and in a different environment. And this Colorado School Health Consortium has really been a leader in school Medicaid policy and done a lot of great policy and advocacy work. And Colorado is also facing some tough cuts. So I'm wondering how you're encouraging actually school districts, working with school districts, thinking about how to support school districts and really strengthening their program in a moment that feels, especially kind of fraught and challenging, at the state and district level.
Absolutely. Thank
And
you,
you can tell,
Jesse.
yeah. Thanks.
Again, I'm with the Colorado School Medicaid Consortium. So Colorado has really benefited from long-term advocacy around Medicaid and the Medicaid in Schools program. Our organization was created by advocates that really work together to get Medicaid in Schools program, or the School Health Services program, implemented in Colorado, 28 years ago. And so we've continued to have advocates and really have a collaborative model in Colorado. And that is at state agency level, as well as within the local education agencies, school districts, collaborating, working together, and understanding the importance of Medicaid and the importance of this program. So it really helps the state Medicaid agency and the state education agency in Colorado work together to jointly oversee and manage the program in Colorado and have a really good working relationship as state agencies. And then the LEAs, they really support the LEAs with, ensuring that they're in compliance, managing the program. They have a stakeholders group at the state level for regional representatives from the LEAs. And so that's where the LEAs are able to, advocate, ask questions, engage with the state agencies about what they need and what's going on at the school district level or the education agency level. We also really support a collaborative model. You have to advocate and work together, and people need to talk to each other. So everyone has, talked about that a little bit. You can't do this in a silo. You need to have support. You need to have people speaking to each other, helping each other to manage what's going on. So in Colorado, this program has a lot of support from the school districts that participate in the program. In Colorado, school districts or local education agencies are not required to participate in the program. But most of the large districts do, in the districts with the largest student population, and they have found that what they receive from Medicaid, from participating in this program, has really helped them increase their ability to support nursing, mental health, behavioral health within their districts. And so they don't want to lose that funding. They don't want to lose access. And so they have the opportunity and do get together, really creating buy-in from at the school district level from your leadership. So as we know, everyone who works in school Medicaid, this is a tiny program. And it's a huge program, but from different people's perspective. And so making sure that people understand what this is doing for supporting student health, and creating that buy-in at all levels on how important this program is. So even at the state level, our program is a carve-out program. So how HR 1 changes, Colorado has a budget deficit. They are making changes at all levels in areas that some of the other panelists have talked about related to parent caregivers and some other, and they're really looking at that. What is important for this program is to advocate for not changing how the reimbursement comes in, not changing that aspect of these funds coming into the districts, and looking at it from a school health perspective, and that these funds are helping support paying for health services in schools, so in K-12 education, and how we're really looking at making sure that school districts continue to see the value in participating, and they do. I hear from school, participating local education agencies, school districts, regional collaboratives, and cooperatives that also participate in the program, that losing this funding would be devastating to their programs. So because everyone talks, works together, we have that groups of people and perspectives to not only at the state level and within Medicaid, but also in local education agencies with that leadership to say this is really important program. It's really helping, cover the cost of being able to have health services in schools.
Carolyn, thank you for that. I'm going to ask you another question, but first let me just say that we're going to take you. We see questions in the chat already. Thank you so much for those of you putting questions in the chat, and keep them coming. And Lena, we're going to bring you back on for the Q&A. So if Lena is still, oh, there she is. You're on the screen now. We'll just wanted to keep you around for the Q&A too, as more people throw questions into the chat or Q&A. But Carolyn, I wanted to ask you, kind of building off of what you just said, how are you're protecting the program and you're talking about the value of the program at the same time. It is a complex, school Medicaid is a complex program and needs, always needs improvement. How are you balancing that at a time when it feels like we really need to defend where we're at, but also keep moving things forward?
And this, may seem at the very basic level, but part of what we do is really support districts with how they manage that compliance. Some of those, and really helping rural school districts. Rural school districts have the biggest administrative burden, as we know, to participate in the program. So how can we help them share people, administrators that can help manage the program? How do we help them have mentors, work together? What is best practice? How do you help meet those compliance pieces with the program? And that's, part of advocating for the program. So, our organization has luckily in the past, and we're looking at this moving forward, offered mini grants to help pay for the cost of someone to administer the program, as districts don't see that they have the funding to do that initially. We have districts and cooperative agencies sharing administrators, or sharing what we call coordinators, to help manage their program. And then again, at the state level, they have stakeholder group and their regional representatives, and those regional representatives act as mentors. And we have an advisory committee who also is capable to act, able to act as mentors, to help with those compliance pieces and that administrative burden.
Thank you for that. And Nikki, I wanted to ask you a similar question from your perspective as a parent, from Family Voices. How that sort of similar question, how are you helping parents know that there needs to be, how do you balance the need between protecting Medicaid while also knowing it is imperfect and continues to need to support families in ways that we haven't been able to get to yet?
I think those of us who are involved in multiple systems understand that those systems are not always going to operate perfectly. However, our voices can be transformative. And so that is where we encourage families to get involved in the advisory committees and actually be those voices. And a lot of our national network participate on those groups, and some of them are leaders of those groups. And so that's where we encourage families to lean in. Dismantling something that's not working perfectly is not the answer, right? The answer is to make it better, and we have to do that by using our voices to improve it, to state where the sticking spots are and the pain points are, and then helping to move that along by collaborating with some of the other folks you see on this call. And so I think, like we said, we all have to be collaborating, we have to be working together, and we encourage families to use their voices in that way so that they are part of that collaboration and their concerns are brought forward.
Thanks so much, Nikki. And I'm seeing some questions in the chat. I do see one from Denise that if any of the panelists know an answer to, I do not, but we can look into it. And some other just great comments that people are sharing. So keep those coming. Oh wait, we might be able to get to Denise's question. As we're for a question for all panelists that I just wanted to lift up is what are some of the messaging that you're using right now that you found especially helpful across this issue? What are how do I word this exactly? What would you say has been some of the most compelling arguments that you've been able to use in your advocacy and to help others get engaged. So Nick, you kind of touched on that as well. Stephanie, I'll go to you, and then Erica just does that from the advocates the state advocacy world.
Yeah, I think a lot of our messaging that works the best is the storytelling, like everyone else has mentioned, having individual parents tell their stories and talk to policymakers is usually the most effective. We may be reviving a campaign we did several years ago that I think started in Arkansas. I'm pretty sure we stole it from Arkansas, maybe Alabama, called I Am Medicaid. And I think we had lots of personal stories posted, and we've been doing that through Protect Our Care. And consistently then, and I feel like still now, and I'm sure everybody on this call has experienced this, a lot of people we talk to, including policymakers, do not know that Medicaid and schools have anything to do with each other, and that Medicaid provides so much funding to their school districts, to their families, and not just families with special education issues, but also general ed. So I think like that's sometimes just a hurdle. And so those messages from parents talking about how important Medicaid is, not just for school services, but also their own health and the children's health in out of school. So I think that works kind of best. I guess that's what I mentioned.
Yeah. Thanks so much, Erica. What about you? Have you found any arguments most compelling?
Yeah, I think it goes back to again having this historical arguments and also kind of lumping issues together sometimes when it comes to overall health and access in our state and what, legislators say their intent is versus the reality of what's happening. And so one good thing, and I did write a blog on this earlier last year, but time flies. But basically, how we're not just dropping the ball with schools and Medicaid, but we're also dropping the ball with children's health insurance implementation as well, right? In 2023, Florida passed a law to expand our child health insurance program. Up to 300% the federal poverty level, which would have provided an additional 42,000 children with healthcare coverage in our state. And so they passed the law, but then decided to sue CMS over a 12-month continuous eligibility provision that they did not wish to implement within the Kid Care program. And so this lawsuit has delayed this implementation, this increased healthcare access, and it just kind of goes to the point to say, if you truly cared about children's healthcare access, why is this being delayed and why are we still not implementing Medicaid in schools while we're on that note, right? So being able to sort of draw these issues together is always a really good sticking point and talking point. Just to say, like, historically, we're messing up in more ways than one, and it's having these detrimental impacts to families who could benefit from this, both in schools and out of schools. And so that's been huge. And then another thing is, again, that budgetary argument as well, just being able to point to the fiscal and say, it's not that expensive, just do it. Um, with how much we already spend on Medicaid, this 12-month continuous eligibility policy costs $12 million, which is literally a pocket change when it comes to Florida's Medicaid program. So these are things that we continue to do and continue to look back historically about again, where the ball has been dropped, and then again, lumping them all together.
Thank you so much for that. And Lena, I know you're typing maybe to a question in the chat, but do you want to just touch on that around states that are looking at cutting school-based Medicaid, how to respond to those proposals or proposals that have proposed funding? And I know you touched on that as well, Carolyn, but Lena, do you want to talk about that?
Yeah, I actually just want to lift up what Stephanie and Erica said on the messaging, both as a defensive strategy and as a proactive strategy, and the importance of continuously educating and lifting up the value of school-based care and Medicaid's role in paying for it as a financing structure. I think it was Stephanie who said that, people don't even understand that they're related. So it's the education on that. It's all of the messaging things that Stephanie and Erica just said. And because it is a relatively inexpensive investment compared to the broad Medicaid program, that budgetary piece, I think, is what we need to be doing on a day-to-day basis to demonstrate value. And to the question we got in the Q&A, a big part of our response when faced with cuts. I could take it a little bit further about the irresponsibility of cutting student health services during a mental health crisis among our youth, during a time when services are diminishing in federal funding. It is a short-term and long-term bad policy choice to do this. So I think we can respond in a lot of different ways. Um, I will just add on, Washington, Minnesota were the examples. I know Idaho is looking at reimbursement cuts for providers across the board, just broadening it a little bit in the budgetary context, and joining with the whole Medicaid protection coalition. I mean, Stephanie's talked to that, but I want to lift it back up because all boats need to float for kids' health here. And so it's a false dichotomy to have to choose between them. And so that's how we're responding to these questions. Jesse, I'll turn it back.
Thank you, Lena. And we are almost at time, so there's so many questions and you are such amazing experts that I'm like, it's a little painful to say we're going to close up this discussion, but I also want to respect everybody's time that's come. But see the incredible faces on the screen. Please, I'm volunteering y'all, but reach out to continue to hear their expertise, their knowledge, and the resources. So many great resources that their organizations have, that they have. So thank you all so much. There's questions that are still in the chat. If anybody, Karen, I see your question about digital cuts. Or digital technology in the classroom. That's such a good question. And I don't think we have time to answer it, but if anybody has a quick response, please feel free to drop that in the Q&A too. But thank you all so much. Thank you so much to Carolyn and to Nikki and Stephanie and Erica for the work that you're doing every day and for just joining this conversation to share just a little of your incredible expertise and knowledge in this field right now. So thank you so much. I'll quickly wrap us up, and I just want to share one other resource from Healthy Schools Campaign that I think would be helpful as we're moving forward too. It's a resource that we developed with Community Catalyst, another great organization, to help protect and advance school Medicaid. It's an advocacy toolkit, and it really gets to a lot of the messaging and the talking points that were discussed today, actions you can take to both protect and amplify the importance of this program. So we'll be sharing that as well as the other resources, but that's a great resource that has a lot of, I know there were even some questions that came in about different talking points and messaging you can use, and that's laid out very clearly in this toolkit. We also have a number of other resources that we'll be sharing after this, including some from our partners around how cuts and Medicaid policy changes are affecting immigrant students and rural health. Jeremy, I saw your question, and I know Carolyn mentioned, but just the need to support rural health and even where rural health transformation grants may play a role. And with that, let me just say thank you so much again to everyone for joining us, to our incredible panelists, and to all of you for sharing your knowledge and sharing your expertise and perspective throughout this conversation as well. We want to keep this conversation going, so we'll be following up with questions that we don't get to today, but please just know that we are here and we are open to talking at any time, and keep those questions coming, and we'll be following up very soon to share the resources and questions that you all sent during today's conversation and ahead of the webinar. So thank you so much again. We really appreciate this conversation, and we're all in this together, and we're all stronger together. So thank you all again, and onward we go. So enjoy the rest of your day, and we look forward to being in your and continuing this conversation soon. Thanks again.